Hi, I'm Kristen Palmer, and I'm at Pinehurst Surgical today, joined by Dr. Andrea DiMichele. How are you?
Very good, thank you.
Thanks for joining us.
Thank you.
Dr. DiMichele is an OBGYN here at the clinic and does some procedures that are actually very fascinating and address a couple of things that you may not even know can be addressed. One is heavy bleeding.
Yes.
Lots of women deal with that. And another is permanent contraception, which
Correct.
we're going to talk about first. But I want to know a little bit about you, Dr. DiMichele. You've lived in North Carolina for 4 years.
We have.
And most recently moved a couple of years ago here to Pinehurst.
Exactly. My husband and I decided that North Carolina was definitely a place we wanted to live, brought our children down here, and have heard wonderful things about Pinehurst, just medical community, wonderful place to live, and we moved here 2 years ago and have been thrilled about it ever since.
Yes, and Pinehurst Surgical is such a state-of-the-art facility.
It is amazing. It really is.
We have
blew me away when I first came here.
The doctors here are all very, very good, and we're lucky to have all of you here.
Thank you.
All right, let's first talk about the permanent contraception that we can get. Why would a person choose to do that?
A lot of women decide that once they've completed childbearing, they don't want to continue with the hormonal contraception. They want something that they know has a greater efficacy and the reliability of a permanent contraception. And they think that the only option available to them is a surgical procedure, the normal traditional bilateral tubal ligation. So what I want to talk about today is an alternative to that, and an office procedure called the Adiana. And the difference between the Adiana and the traditional bitubal ligation is the bilateral tubal ligation is the mechanism of the procedure. Now, when you perform a tubal ligation, it requires an incision at the belly button right below it, and it's in the surgical center, in a hospital, laparoscopic procedure where the instrument is placed through the umbilicus below the belly button, and the tubes are tied this way. Tubal ligations occurred here, a clip, a band, burning, multiple ways of ligating the tubes. This is an outpatient procedure, but it is a surgical procedure that requires general anesthesia.
Okay.
The other option is the Adiana, which is in office. This is a procedure that's done a little differently, but has a quicker recovery and equal efficacy. The mechanism is the cervix is dilated slightly, a device is placed into the uterine cavity, and the tubes are blocked internally. There is a little device that is placed into
And this is amazing, the size.
into the uterine cavity, about the size of a grain of sand. Your own tissue is going to grow in and around this device to block the tubes off. It will take a full 3 months for your tissue to grow in around this. So during that 3-month period, most people are required to use some form of backup contraception. And then after the 3-month period, when this is completed, a dye test will be performed to ensure that your tubes are tied and that the procedure was successful.
Okay.
Where dye is injected into the uterus and the tubes are confirmed to be blocked.
And the success rate of this is phenomenal.
It is excellent. And what I would like to also point out here is a comparison of the Adiana to a more probably well-known, not necessarily better, but more well-known mechanism is the Assure. This is actually the coil for the Assure.
Okay.
And the comparison of the two is the Adiana is smaller, and unfortunately in trials the Assure has been shown to migrate and perforate where the Adiana does not.
Okay, so it's safer.
Yes.
Okay, very good. All right, let's talk also about the heavy bleeding, which I'm telling you, this is something that women suffer with, and if you are someone who suffers with that, you have, it affects your personal time, it affects how you dress, it affects where you can go. Let's talk about how you can address that here in your office or in the hospital.
I agree with this. This is a silent problem a lot of women don't want to talk about. They think this is just a part of their life, something they have to deal with. I've had a couple children, I'm getting older, I just have to put up with these heavy periods. Or they think the alternatives are continuous birth control pills, the side effects that go along with that, which aren't an option for everybody. Or a hysterectomy, which requires 6 weeks of recovery, a big surgery, any complications that go along with that. What I want to tell people, there is another option. There's an option that is a quick recovery, a quick, simple, and effective procedure that is wonderful results and people are thrilled with, but just not quite yet aware of it yet.
And you may be sitting out there and saying, I thought I was alone with this problem.
Exactly.
A lot of people don't talk about this because it's your personal life we're dealing with here.
Right.
And people don't want to come to the doctor because they fear that, the pain involved, the cost involved, a lot of different obstacles which we're going to address because the cost, many, many times, in fact, most of the time, covered by your insurance. And you can come in and have a consultation and ease all of your fears with Dr. DiMichele and then get something done, and your lifestyle and quality of life is going to improve.
Absolutely. Whereas the Adiana is solely a procedure that's completed in the office, the NovaSure can be completed both in the office, in the hospital, surgical center. A lot of it is just personal preference. Some medical conditions may play into this part here, and some of it may even be financial, where sometimes the NovaSure in the office is simply just a copay.
Okay.
So it makes a big difference in today's economy.
Well, it's certainly worth the consultation to come in and meet Dr. DiMichele. Okay, let's talk about the procedure itself and how that works.
What I'd like to show here is a picture of the uterine cavity here, menorrhagia, which is just a medical term for heavy bleeding. It is this lining here that is growing and throwing out and causing people these heavy periods. So it's this lining that the NovaSure goes in and removes and destroys. I want to make the clarification that this is not going to throw you into menopause. We are not destroying the ovaries here, which is controlling the hormones. Those hormones are affecting the lining growth and causing the heavy bleeding, but you will not go into menopause with this procedure, solely just treating the heavy bleeding. This is actually the device that is used to go into the uterine cavity. Again, cervix is dilated slightly in office with some local anesthesia and some mild pain medications to help make the procedure more comfortable. This is inserted into the uterine cavity. The device is activated. The uterine cavity, the walls are pulled towards this device by a suction mechanism, and it's emitting a RF energy that will help destroy the lining of the uterus that's causing these heavy bleedings permanently. So most people, over 90%, are experiencing minimal to no bleeding at all.
And when would this procedure cross over with the other procedure we were talking about? Sometimes you need to get both.
Absolutely, because this does require a form of contraception. So most people who do this already have had their tubes tied and are experiencing heavy bleeding and want a treatment for that mechanism. But you can do both of them. They just require a few months in between for a healing process to occur.
And I remember just that first weekend of being so heavy that I was just standing there and it was running down my leg like water. And I called my girlfriend and I said, I don't know what's wrong with me, but I feel like I'm hemorrhaging. Is something wrong with me? I'm so young. Before the onset of my monthly, I would be really tired and I'd have cramping and then I'd have tender breaths. And then once my monthly started, I would have very severe migraine headaches. When I heard that there was a procedure out there where they could like literally almost stop your periods or maybe go to 1-2 days, I was there. Enough research has been done that I think it's safe and it's productive. If women only knew, it only took 90 seconds and insurance covers it. $1 million. Through my story, I'm hoping that I can help just even maybe one woman. Maybe it'll be a close friend, a relative, maybe even my own daughter. Because I know that this is going to work for me, and I want other women to know that it'll work for them.
We also want to talk about the fact that Dr. DiMichele is an OBGYN, and you can call and get an appointment if you're 20 or if you're 60 with Dr. DiMichele and have a wide variety of things that you do here in your practice.
Standard obstetrician and gynecological care.
Okay, so whatever your issue is, or if you don't have an issue and you need an OBGYN, Dr. DiMichele's a lovely person and you need to come over to Pinehurst Surgical, make an appointment with your secretary.
Right, her name's Ashley.
Okay, very good. Well, we thank you for joining us today.
Thank you, I appreciate it.
Okay.